Substance intoxication. Essential features of substance intoxication. Transient and clinically significant disturbances in consciousness, cognition, perception, affect, behavior, or coordination that develop during or shortly after the consumption or administration of a substance. The symptoms must be compatible with the known pharmacological effects of the substance, and their intensity is closely related to the amount of the substance consumed. The symptoms of intoxication are time-limited, and abate as the substance is cleared from the body. Symptoms are not better accounted for by another medical condition or another mental disorder, including another disorder due to substance use, for example, substance withdrawal. Medical conditions that may present with symptoms similar to substance intoxication. Head injury, with or without cerebral contusion or intracranial hemorrhage or hematoma, meningitis and encephalitis, diabetic ketoacidosis or hypoglycemia, hepatic or other metabolic encephalopathy, Wernicke's encephalopathy, electrolyte disturbance, hypoxia or hypercapnia, systemic infection. Severity of intoxication specifier. Depending on the specific clinical situation and the information available, substance intoxication may be classified according to the level of severity as mild, moderate, or severe. Excess 5W mild. Mild substance intoxication is a state in which there are clinically recognizable disturbances in psychophysiological functions and responses, for example, motor coordination, attention and judgment, that vary by substance, but there is little or no disturbance in the level of consciousness. Excess 0T moderate. Moderate substance intoxication is a state in which there are marked disturbances in psychophysiological functions and responses, for example, motor coordination, attention and judgment, that vary by substance, with substantial impairment on tasks that require these functions. There is some disturbance in level of consciousness. Excess 25 severe. Severe substance intoxication is a state in which there are obvious disturbances in psychophysiological functions and responses, for example, motor coordination, attention and judgment, that vary by substance, with marked disturbance in level of consciousness. There is severe impairment to the extent that the person may not be capable of self-care or self-protection, and may be unable to communicate or cooperate with assessment and intervention. Common substance-specific features of substance intoxication. 1. Alcohol intoxication. Presenting features: impaired attention, inappropriate or aggressive behavior, lability of mood and emotions, impaired judgment, poor coordination, unsteady gait, and slurred speech. At more severe levels of intoxication, stupor or coma may occur. 2. Cannabis or synthetic cannabinoids. Features of intoxication: inappropriate euphoria, impaired attention, impaired judgment, perceptual alterations, such as the sensation of floating, altered perception of time, changes in sociability, increased appetite, anxiety, intensification of ordinary experiences, impaired short-term memory, and sluggishness. Physical signs include conjunctival injection, red or bloodshot eyes, dry mouth, and tachycardia. Regular intoxication with high-potency cannabis or synthetic cannabinoids may be associated with increased long-term risk for psychosis. 3. Presenting features of opioid intoxication may include somnolence, stupor, mood changes, for example, euphoria followed by apathy and dysphoria, psychomotor retardation, impaired judgment, respiratory depression, slurred speech, and impairment of memory and attention. In severe intoxication, coma may ensue. A characteristic physical sign is pupillary constriction, but this sign may be absent when intoxication is due to synthetic opioids. Severe opioid intoxication can lead to death due to excessive respiratory depression. Overdose is more likely to occur with higher potency opioids, for example, fentanyl, when the person has reduced tolerance, for example, after detoxification, or when an individual who has developed tolerance uses the opioid in a novel environment. 4. Presenting features of sedative, hypnotic or anxiolytic intoxication may include somnolence, impaired judgment, inappropriate behavior, including sexual behavior or aggression, slurred speech, impaired motor coordination, unsteady gait, mood changes, as well as impaired memory, attention and concentration. Nystagmus, repetitive, uncontrolled eye movements, is a common physical sign. In severe cases, stupor or coma may occur. 5. Presenting features of cocaine intoxication may include inappropriate euphoria, anxiety, anger, impaired attention, hypervigilance, psychomotor agitation, paranoid ideation, sometimes of delusional intensity, auditory hallucinations, confusion, and changes in sociability. Perspiration or chills, nausea or vomiting, and palpitations and chest pain may be experienced. Physical signs may include tachycardia, elevated blood pressure, and pupillary dilatation. Additional features. In rare instances, usually in severe intoxication, cocaine use can result in seizures, muscle weakness, dyskinesia and dystonia, and myocardial infarction or stroke arising from coronary or cerebral artery spasm, respectively. 6. Presenting features of stimulant intoxication may include anxiety, anger, impaired attention, hypervigilance, psychomotor agitation, paranoid ideation, possibly of delusional intensity, transient auditory hallucinations, transient confusion, and changes in sociability. Perspiration or chills, nausea or vomiting, and palpitations may be experienced. Physical signs may include tachycardia, elevated blood pressure, pupillary dilatation, dyskinesia and dystonia, and skin sores. 7. Presenting features of synthetic cathinon intoxication may include anxiety, anger, impaired attention, hypervigilance, psychomotor agitation, paranoid ideation, possibly of delusional intensity, transient auditory hallucinations, transient confusion, and changes in sociability. Perspiration or chills, nausea or vomiting, and palpitations may be experienced. Physical signs may include tachycardia, elevated blood pressure, pupillary dilatation, dyskinesia and dystonia, and skin sores. In rare instances, usually in severe intoxication, use of synthetic cathinones can result in seizures. 8. Presenting features of caffeine intoxication may include restlessness, anxiety, excitement, insomnia, flushed face, tachycardia, diuresis, gastrointestinal disturbances, muscle twitching, psychomotor agitation, perspiration or chills, and nausea or vomiting. Arrhythmias. 9. Presenting features of hallucinogen intoxication, hallucinations, illusions, perceptual changes such as depersonalization, derealization, synesthesias, such as a visual stimulus evoking a smell, anxiety, depressed or dysphoric mood, ideas of reference, paranoid ideation. Impaired judgment, palpitations, sweating, blurred vision, tremors and lack of coordination. Physical signs may include tachycardia, elevated blood pressure, and pupillary dilatation. 10. Presenting features of nicotine intoxication may include restlessness, psychomotor agitation, anxiety, cold sweats, headache, insomnia, palpitations, paresthesias, nausea or vomiting, abdominal cramps, confusion, bizarre dreams, burning sensations in the mouth, and salivation. In rare instances, paranoid ideation, perceptual disturbances, convulsions, or coma may occur. 11. Presenting features of volatile inhalant intoxication may include euphoria, impaired judgment, aggression, somnolence, stupor or coma, dizziness, tremor, lack of coordination, slurred speech, unsteady gait, lethargy and apathy, psychomotor retardation, and visual disturbance. Muscle weakness and diplopia may occur. Intentional or unintentional exposure to a variety of volatile inhalant substances, for example, glue, petrol, butane, paint, can cause the symptoms of volatile inhalant intoxication. Intentional volatile inhalant intoxication typically involves sniffing or huffing the substances from closed containers, a practice which may lead to hypoxia, and hypoxic brain damage and other long-lasting neurological sequelae. Use of volatile inhalants may cause cardiac arrhythmias, cardiac arrest, and death. Inhalants containing lead, for example, some forms of petrol/gasoline, may cause confusion, irritability, coma and seizures. Use of volatile inhalants is more common among adolescents and young adults due to greater ease of access as compared to other psychoactive substances. 12. Presenting features of MDMA or related drug intoxication may include increased or inappropriate sexual interest and activity, anxiety, restlessness, agitation, and sweating. In rare instances, usually in severe intoxication, use of MDMA or related drugs, including MDA, can result in dystonia and seizures. 13. Presenting features of dissociative drug, ketamine, PCP, intoxication may include aggression, impulsiveness, unpredictable behavior, anxiety, psychomotor agitation, impaired judgment, numbness or diminished responsiveness to pain, slurred speech, and dystonia. Physical signs include nystagmus, repetitive, uncontrolled eye movements, tachycardia, elevated blood pressure, numbness, ataxia, dysarthria, and muscle rigidity. Thanks for watching. Please like and subscribe.